tutoring sessions to go through the whole study guide. I don't. I expect you guys to do your part as well. Okay. For all of you that just came in, if you could put your name and your professor in the chat, that'd be great. We like to take attendance, and we also like to, we share the attendance and the recordings with Professor Kershaw and Dr. Ford. Okay, so with all that being said, here's my test taking tips. And these are just off the top of my head, and this is from doing dozens and dozens of reviews. Do not change your answers unless you can convince yourself why the answer was wrong. Like solid, not like I think I saw it somewhere where it said. No, you have to be able to talk yourself into a solid answer of why you're going to change it. Okay, I would suggest reading the questions first and then covering them up, or putting a sticky there, or looking away. See if you can come up with the answer in your own head. Okay, and then go back to the answers and see if there's something in there that matches. And if there is, it's most likely the correct answer. Okay, don't read a question more than 2 times. Okay, if you are clueless after the second time, like totally clueless, do not keep going. Okay, make an educated guess and keep going. Okay, I just need to make sure I'm recording here. Yeah. Okay.
It's recording.
Yep. Okay. What else? Just read it twice. Do not get bogged down on questions, because you're going to get frustrated. Your confidence level is going to go down. You're going to get more anxious. So give it a shot with a couple of tries. And if not, then just educated guess and move on. Watch your time. Watch your time. I mean, you've got 75 minutes to do it. That's a lot of time. Take your time. Watch your time. You don't rush through the exam. All right. You have to be able to pull out certain phrases and words in questions. What are those important phrases and questions? Important phrases and words in your questions. What are you looking for? Priority questions. What's the first? What's the last? What's the greatest? What's the least? What other words are you looking for? You know, in your nursing assessment, which would the nurse do as a priority? You got to be able to pull those words out of your questions. Okay. And use your paper, your whiteboard, or whatever you're using to write those words down. Okay. And read the question a second time to see if, with most of my reviews, I'll tell you where students get tripped up. They get tripped up on the priority words. Okay, the priority words in the questions: first, last, greatest, least. And then the other place you guys get tripped up is the questions that are asked in a negative way. So let's say you're mentoring a nursing student and you are listening to them communicate discharge instructions with a patient. What do they say that may require further education? So what does that mean? How is that asked negatively? Because you're looking for the wrong answer, right? You're
wrong
looking
answers.
what?
Wrong. We are looking for the wrong answers and what they shouldn't be doing.
Exactly. So I always use the smoking in the house. So let's say if you're talking with a parent about the dangers of smoking to kids, long-term health effects, whatever. What does the parent say to you that you know that she's going to need more education? So she says something like, well, I vape now, or I do e-cigarettes now, right? That's not the right answer, right? You need to correct her on that. So it's asking it negatively. What are they saying that requires more education? Does that make sense?
Yes.
And there's questions like that mixed in. All right. So you got to be able to identify what's being asked the backward way. I say negative, but it's the backward way. You know, what requires more education? What requires more teaching? So be careful of those questions. Okay. And then what else? Does any of you guys have any test taking strategies that you use that would be helpful to your peers? What do you guys do?
I do process of elimination.
If I'm answering the question,
Yep.
I don't know anything about, I may not know any information in the question, but I will
Yep.
pick out what I do know and try to answer the question based on what I do know.
That's excellent. Excellent. And that brings me to another strategy. That's excellent. Read the question. If it's too wordy for you, rethink it in your mind into a simpler sentence. Is that what you're saying? Yeah.
Yes.
Does that, yeah, that's another good strategy. Reword it to something you can understand that's small and manageable to think about before you start going looking at the answers. That's excellent. Anybody else?
Like if they're asking something negative about diabetes, then if you don't know anything negative about diabetes, you may know something that's positive about it.
That's exactly
So
right.
try to answer the question.
Yep. Yep. So let's think of a question like that. Give me a negative diabetes question. So, go ahead, try and give me a negative diabetes question.
So maybe it'll ask something like, should someone with type 1 diabetes eat 100% fruit juice?
Okay, great. So what would, okay, hang on, let's think through this here.
You may, because you may not know if they can have it. Like you might not want to know 100% if they can have it, but you do know that somebody with type 1 diabetes shouldn't have a lot of sugar.
Right. How about the question like, select the food that you should avoid with type 1 diabetes? How about that? Then you're looking for the negative, like sugar. 100% fruit juices would be the correct answer because it's wrong.
Right.
Does that make sense? And so if they said, if for them, you know, fruits and vegetables, whatever 4 healthy foods were, and then you threw in 100% fruit juice, and the question was asking what to avoid, that's a negative question. So you're looking for the wrong, the 100% fruit juice. Is that what you're, yeah, that makes sense. Does that make sense to you guys? Just be
Yes.
careful of those questions. Okay. So you have to be able to separate out a positive question and negative question. Okay. Anybody else have any more test taking strategies before I go into the study guide?
I do process of elimination.
Yep.
I look at the answer options. There are some that does not even make sense, doesn't even connect with the question.
Great.
And I
So,
rule those out and I look at those that have something to do with the question and I look for the right answer.
that's perfect. And I sent you guys a test taking tutorial about breaking questions down, just like that. And part of that tutorial has a couple of slides on how to eliminate a couple of answers right off the bat. Like the ones that don't have any, they're not even in the ballpark of what the question is asked. You can cross those out right away. Now you're down to 3 answers or 2 answers. I sent you guys a tutorial about that. That's excellent. Yep. If anybody struggles with math, you got to go to the few tutorials I sent you in week 1. They're really easy. They break down formulas. They do conversions. They do simple calculations. So go back and look at those. I call them little cheat sheets. So if you have problems with setting up formulas and all that, go look at those. Okay. All right. Okay. A couple of things. You got to understand the difference between community oriented and community based nursing. Anybody been out looking at the study guide? Anybody have a handle on that yet? I told you guys my little cheat sheet way of remembering it. If you're practicing in a community oriented role, that's the big picture. You're trying to orient yourself to the community. Okay, so you're focused on health promotion rather than illness. You're looking at the whole group rather than a specific group. So that's the big picture. You're orienting yourself to the community. Where community-based, you're working in the community. Okay, you're caring for the ill people in the community. So you might be a home health nurse, you might be a hospice nurse, you might be a school nurse, you might be an occupational nurse. You're working in the community. All right, so it's illness instead of health promotion. Okay? That's the easy way to remember that. Let's review primary, secondary, tertiary. Okay, primary, I do P for P, S for S, T for T. Okay, primary is prevention, secondary is screening, and it's right here in your study guide. Tertiary is treatment. Okay, the one thing I don't want you to confuse is education. If the word education is used in a question, education is not specific to primary. A lot of people confuse, oh, and in primary, we're educating on how to prevent. Well, yes, we are, but in secondary, we're also educating. Secondary is early identification, early intervention. So it's screening for risk. But let's say we've screened a bunch of high school students for obesity and we have a group that's at risk for obesity. Well, we're going to be working to educate them on long-term effects of obesity, right? And so that's a different way to educate. So education in the primary is educating to prevent. Education in the secondary is educating to reduce risk. Now we're also educating in the tertiary level, right? And remember, tertiary is treatment. They have something. They have a disease, they have a condition, they have something. So now we're trying to help them manage whatever it is going on. Whether it's a disease, a condition, accident, we're trying to help them improve their quality of life. So if somebody has diabetes or they're obese or they have mental health issues, we are working with them to help manage that. Okay. And so that requires education too. Right. So don't get tripped up on education being just a primary part of the primary prevention. Education is part of all three levels. Okay. What do we consider vulnerable populations? I like to highlight, so I'm just going to highlight as I go here. All right. This is considered for purposes. Oh, I probably can't highlight because I haven't. All right. So there's several vulnerable populations that are identified from this course, and it's listed right here. The poor, homeless, pregnant teens, veterans. Don't forget about veterans, migrant workers or immigrants, mentally ill, substance abusers. Okay, chronic STDs. So if you get if you're asked about vulnerable populations, know that these, for the purposes of this course, these are our vulnerable populations. Okay. Next word is social determinants of health. That's the fancy way of saying what determines our health. What kinds of things do we look at that determine the health of remember, community. In community, your client can be an individual, a family, or a community, right? So social determinants of health. So that may be looking at what determines the health of the individual, what determines the health of the family, what determines the health of the community. Okay. And here's how we measure social determinants of health: safe housing, transportation, neighborhoods, any racism in the community, discrimination, violence education. I mean, these are kind of common sense things that you would look at to determine, like, if you think about it. If you live in a community that has very, very high crime rate, okay, your health may be more at risk. Okay, if you live in a community that has limited transportation, doesn't have safe housing, you're going to be more at risk. Okay, if you live polluted air and water, if you live near an airport, your air may be compromised. Okay, literacy skills. If you don't have literacy skills, right, everything's going to be compromised. So these are just factors that we look at. I mean, think about your zip code right now and think about each of these things. Do you have safe, what are the risks in your community? Do you have safe housing? Do you have good transportation? Are your neighborhoods good? Is it very culturally diverse? Is there violence? What's the unemployment rate? Right? What are the vulnerable populations in your community? Okay, we do know that poverty is definitely the primary cause of vulnerability. You got to remember that. Financial poverty, financial stability of an individual, family, community is the primary cause of vulnerability. Okay. Education definitely plays a role, but not just because it's related to income, right? So higher levels of education lead to better choices. Education also influences the perceptions of stressors. So for an example, I teach up in the RN program as well. One of our exam questions, I don't remember which exam, but it doesn't matter. But one of our exam questions is working with teen pregnancy. Okay, so let's say I forget how exactly the question is, but what is the most important intervention for a teen pregnant mom? And it gives, and it's a priority question. What is the most? And so the answers are like,
nutrition,
nutrition, prenatal care. But because the question asks, what is the priority? The correct answer is keeping that student in school.
Oh.
That's the priority. Keep that student in school because we know that education plays a role. Okay. And then we've talked about some of these. What are some outcomes of vulnerability? Okay. If there are no interventions and you have less access to care, you're going to be less healthy. You're going to have risks of increased morbidity and mortality. And I'm just going through, just take notes right on your study guide, right? There's certainly a high prevalence of chronic illness. I mean, think about it. Think about vulnerable populations in your community. Think of how much additional risk they assume. Okay, what are some interventions? Therapeutic communication. Okay, really important in nursing. Okay, respecting each individual as unique and worthy of your respect and kindness. No assumptions, no judgments. And the most important thing with therapeutic communication is let them tell their story. Okay, open-ended questions, let them tell their story. Avoid questions, making assumptions. Here's an example. How long have you been abusing drugs? Why do you let your husband abuse you? Those aren't the questions you want to ask. Tell me what's you want to ask, tell me what's going on. Let them talk. Okay. And then two things that are important working with vulnerable populations are resiliency and motivation. You have to understand those two words for this exam. Okay. We need to recognize the role that resilience. Everybody knows what resilience is, right? Resilience is
Keep going.
Pardon me?
Say keep going.
Keep going. Yep. Just grind through, keep going. Right. So lack of resiliency will lead to make decisions that may worsen their circumstances. Okay, so the more resiliency they have, the more control they feel. Okay, so we need to help clients be resilient. And then the other thing we have to remember with caring for vulnerable populations is, what about the caregivers? Right? We can't not acknowledge them, right? They're much more at risk for health issues, mental illness, caregiver burnout, stress. Okay? So primary prevention with this group is checking in before anything happens. How are you doing? What support do you need? You know, maybe helping them with some stress reduction techniques, but we cannot forget about the caregivers. Really important for vulnerable populations. And then working with the homeless. The homeless population is not going to work with you unless, number one priority, you are trying to establish a trusting environment. And I'm reading right from the study guide here. Okay. It's important to create a trusting environment. And that really goes across the board in nursing. Okay. Establishing trust is of the utmost importance. But when you're dealing with the vulnerable populations, it's even more important, because you want them to be able to trust you, open up to you, listen to your suggestions, take your resources, all of that. Okay. There is a history of mistrust and not being cared for by the homeless population. They feel that way. So, you know, it's really important to try and establish that relationship with them, especially if it's a family, a homeless family, right? And we know that homelessness is correlated with poor health outcomes, right? With the homeless, what do they not seek? They don't seek preventative care or secondary care. By the time they need care, they're in an ER with a pretty advanced chronic something, right? They have issues. What other issues do they have? This paragraph discusses it. Access. Their care is sought through emergency departments, which means what? What happens when they end up in emergency departments? Super expensive, super complicated. Okay. And then this green dot here is another paragraph with a little bit more information about resilience, right? Think of all the cultures and the language barriers. Okay. One of the vulnerability can be reversed by obtaining resources to increase resilience. And one of the most common resources is learning the basic language of the country which you reside in. So when you start to talk about rural populations, migrant populations, one of the biggest issues is communication, language barrier. How are you supposed to live in a community if you don't understand the culture or the language? Okay. Any questions about vulnerable populations? Let's jump to school nursing. Okay. So the one thing this second paragraph talks about is being mindful of students in the clinic. Yeah, we take care of whatever, accidents, tummy aches, whatever. But the one thing to be mindful, especially, and it's all the way down in elementary school, is the student that's coming into the clinic with physical stomach aches, headaches all the time. And after a month, you know, it's not that. So what do you need to start looking at?
The things that's going on around.
Say that again.
The home environment.
bullying, harassing, violence, right? So we know that kids are coming to the clinics with everything. But if you've got a kid that's still coming in 2 weeks later and complaining about the same stomach ache, you've talked to the parents, whatever, nothing's going on at home, you need to start looking outside your scope of the clinic, right? And start asking questions. And this goes through that. Okay, so this second bullet, the third bullet have to do with bullying, harassing. Next is the rates of obesity. Okay, that's a huge problem. Okay, the rates of obesity in children have risen steadily. Okay, we know that the consequences of childhood obesity they're big and they're lifelong, and they're at risk for so many health issues. Okay, and this goes through it. And then obesity increases the risk of bullying. Okay, so read through that. And then unemployment and depression are issues as well. If you have parents that are unemployed or you have parents that are, or siblings, older siblings that have been diagnosed with depression, right? That places a lot of conflict on the marriage, which is then associated with potential adjustment problems for the kids in the schools. Right? Developmental delays, academic functioning. Okay. So those kids take what's at home, they take it to bring it to school. Right? Another point with school nurses is your interactions with your families should support your goals of establishing a productive and culturally sensitive rapport with families. We live in a very diverse culture right now. If you're in school nursing, the chances of you working with multiple cultures within one building are very, very high. Okay, you have to know, you have to understand values and beliefs and maybe food preferences, life experiences. You know, you have to have an understanding of the different cultures. Okay, and the nurse working in the schools is working towards bridging that gap of the cultural differences. Okay. Next bullet is about the adolescent student who decides he or she is going to start dating. Okay, one of the things we know about adolescent dating is there's a very high incidence of violence. Okay, that's just a fact. So for the adolescent who has done dating, the nurse should assess the student for risk of violence. Okay, so that starts out with, I mean, I guess, what do your friends think of your boyfriend? That's an okay question. What do your parents think? That's an okay question. But if you're being asked a priority question, like what is the most important information to ascertain first? Okay, it's an open-ended question. Can you simply describe your relationship? Right? If they start describing their relationship, you should be able to figure out if they're in a safe relationship or not, right? So asking them to indicate how the student feels about the relationship is the priority, right? Domestic violence can begin early in teenage relationships. As a school nurse, we need to be open to the consideration that any relationship can become violent, right? So let them talk about it in open end, let them share things, right? Let them share things like potential jealous or controlling partners. Okay. Next section is educating parents about maintaining their infant child's health and safety. What should they know? I mentioned this earlier. The greatest impact on a child's overall health is the financial stability of the family. I can't overstate that enough. That's what this whole class, this whole term is based on. Okay, is the vulnerable populations, especially the children. Okay, if you think about it, if there's a very unstable financial situation in the house, everything is affected. Schools, education, maybe food security, everything's affected. Access to healthcare. Okay. Next bullet talks about infant safety guidelines. Have a read through that. There's several. You know, as you read through each of these bullets, think about what kind of question might be asked. Okay, so for example, let's look at this one. Educating new parents about safety guidelines for infants should include, and it gives you 5, do not leave the infant in the bathtub, never leave the infant on an elevated surface, 3, 4, there's 5 there. So what kind of question might you get asked if you get asked about this? Maybe a select all that apply,
Right.
right? What are the safety guidelines? You're working with a new parent. What are the safety guidelines you teach them for infant care? Select all that apply, or pick one, I don't know. Okay, so as you're reading through each of these bullet points, think about what information I'm giving you, and in turn, what question might I ask you? Okay. And then here's some more statistics about when regular checkups, or more teaching points, when regular checkups are recommended every 2 years. Okay, kids should be physically active for 30 to 60 minutes a day. Okay, if you're talking to parents about if they're hesitant about COVID vaccines, provide them the district school data. Okay, or from the public health department, what their rates of compliance are. Next is caring for an immunocompromised child, right? So you want to review with new parents how to prevent infections at home, right? How to keep things cleanly, when to wash your hands before, after eating, touching food, all of that. This gives you, again, a whole list of teaching points to parents. Okay, so please review that. And then firearms. Okay. One of the Healthy People 2030 goals is to reduce the firearm related deaths. Right? We know that gun violence is a risk factor, and accidental injuries with kids happen. All right. So if you're working with a family in the community, you need to do a firearm safety inventory before you go in the home. Right? Or do you have guns in the home? If you do, where are they stored? Right? I know it sounds kind of out there, but that's in the community. That's what we need to do. First thing to do with your visits is, are there any firearms in the house? Are they secured? Are they stored? Make sense? And then I'm going to let you guys go through the common childhood ailments. I have in your, I think, week 3 notes, these are much more detailed. I've really cut them down into what I think that you should know for each of them. Okay, so use this list instead of your week 3 notes for studying most common childhood ailments. Okay, I reorganized this section. Okay, so you know there's probably 6 to 8 bullet points for each. And you guys have already had MedSurg 1 and you're in MedSurg 2, so you should already have an understanding of these, correct?
Yes.
I mean, none of these are unfamiliar to you. Asthma, eczema, diabetes, conjunctivitis. Remember with conjunctivitis, it's a warm pack, not a cold pack that goes over the eyes. Right? You guys knew that, right?
Right.
Lice, guys know about lice, ADHD. You guys have done all this in med-surg. This is the med-surg part of the exam. Okay, iron deficiency anemia, scoliosis. Remember, there's two kinds of scoliosis. Know what functional scoliosis is here, that last bullet. What is functional scoliosis caused by? Okay,
Poor
so
posture.
posture, right. So regular scoliosis is a curvature of the spine, where functional scoliosis is poor posture. There's a difference. And then lead exposure. What do we need to know about lead exposure?
I'm sorry, excuse me.
Go.
Could you, what is the second scoliosis?
Functional, it's right here in your last bullet under that section right here.
Okay.
It's your last bullet under scoliosis. Lead exposure. What's important to know about lead exposure? What do we want to avoid?
The kids eating paint chips, so like
Yeah.
that.
Maybe avoiding old buildings, deteriorating buildings that they say that anything before 1978. Okay, and what are the biggest issues that kids face with lead exposure? Developmental and cognitive delays. Okay. And then there's a whole section on rural and migrant. I think that's it. So rural. So you guys have got to understand the difference between a rural population and an urban population. Okay, tell me what you know. We're going to be doing that today. But what you need to know is that rural populations seek healthcare in a much different way. What do they avoid? What do rural population people avoid?
Going to doctor.
Correct. Why? Access, transportation, cost,
Education.
education. They're just not focused on health promotion. Okay, so that's why your rural population has huge rates of obesity. They have huge rates of chronic illness, because by the time they will go see a doctor, they're already in the advanced stages of whatever they have going on. All right. So one of the most important education tools, if you're working in the rural community, is trying to get them to seek preventative care. Right? I cannot stress that enough. Right? And this is where the other word that comes in, resiliency with the vulnerable populations and motivation for the rural population. It's right here in this first bullet. The rural population is much less focused on health promotion. The community nurse has to work with this population and understand what it's going to take to motivate these people to take advantage of primary, secondary screenings like mammograms and pap smears and blood pressure screenings and whatever. Okay, what it's going to take to motivate this population, because they are uniquely singled out as not as the highest, the most common population not to seek out healthcare. Okay, and so the next couple of bullets talk about motivation, right? Because remember, our role is mostly education, right? That's what we do. And especially with the rural populations, it's a teaching role, right? So what are we going to do to help the vulnerable populations be more resilient? What are we going to do to help the rural populations be more motivated? Okay, so here's a couple of bullet points on to understand motivation, right? Motivation will be most directly impacted positively by interventions that provide information that is relevant and provided by you, the nurse, who they trust. Okay, just think if you were putting together an education program for a group of or rural population, what would you think about? What would be important to them? Well, that's in these two bullets. What will be important to them? How could you motivate them to come to your education program? What's it going to take? Okay. And then definitely we know here in this bullet down here that there's a much more persistent endemic level of depression in the rural population, right? High rates of poverty, economic difficulties, recessions, and isolation, geographic location. Maybe and it gives you a whole bunch of things right here. Insufficient number of mental health people, delays in seeking treatment. So we need to understand what may cause the increased levels of depression among the rural population. Okay, and then you also need to have an understanding of what are the characteristics of rural life? How is it different than urban life? Right? They're much more spread out. There are greater distances between residents. It's usually seasonal work. Right? One of the big issues in rural is the lack of anonymity. Okay, so what results from that is it's kind of a situation where everybody knows everybody. And so, you know, if there's domestic violence going on, if there's child abuse going on, if there's drug abuse going on, they're much less likely to come forward. Right? Why? Because they don't want everybody knowing their business. And that's in the rural setting, that's usually what the ER is saved for, is when situations get so desperate and so dire and they need to seek treatment. But a lot of them won't. I mean, they eventually will need to if it gets to that point, but the lack of anonymity is a huge issue in rural areas. Okay. And then migrant. Oh, go ahead.
What does that lack of anonymity means?
Lack of anonymity means that you really don't get to be anonymous. Everybody knows everybody. It's a small community. You know, the nurse at the health department may be the nurse in the schools. She may be the immunization nurse. She may be the labor and delivery nurse. Who knows? So it means that there's no privacy. How's that? There's no privacy. Everybody knows everybody's business about everything.
Okay.
It's just that kind of a community. Okay. And then migrants have a lot of the same issues, but a lot of their issues are housing related because everything's cyclical, right? Seasonal. All right. And so they may not find adequate housing, or the housing may be in poor condition. Okay. They may end up living in camps or trailers okay. Some live in cars or tents, right? And what happens? Poor quality and crowded places are a breeding ground for what?
Action.
Infectious diseases, namely TB, GI, hepatitis, right? And then migrant workers, because they're seasonal, usually lack any information about what services are available to them. They may have transportation issues, and really language barrier is huge because these migrants are coming from all over. And there may be several groups of different migrants from different countries. Okay. And typically this is important to know here, migrant farm workers are not covered by health insurance. Okay. I don't know if you knew that. And the other thing that they're not eligible for is the WIC, Supplemental Nutrition, or SNAP, they call it now. They're not eligible for that either. So it's pretty challenging for them, even though they come and work seasonally. There's not a lot of federal assistance for them. Okay. So that's the study guide. Helpful?
Yeah, it's a helpful.
Yes.
Okay. Anybody have any questions?
Yes,
Again, like I said at the beginning, if you have a good understanding, I don't mean memorization, I mean a good understanding of the study guide, you're going to have a good understanding of what's on the exam, because we compiled the study guide from what you've been using for the last 3 weeks, from your readings, from your notes that we send weekly, and from the lectures. So everything at this point, you should be familiar with, right? I mean, unless you're one of my students that has class in an hour and we're going to review week 3 information, the rest of you have already had, or unless you have Dr. Ford tonight, the rest of you that are in Dr. Kershaw's Monday and Wednesday classes, everything on the study guide should be familiar to you, right? I mean, we've covered everything in one way or the other, right?
Yes.
yes.
Yeah. And then once Dr. Ford and I get done doing our classes today, everything in the study guide should have been reviewed. That's the purpose of a study guide. It's a review. We're going over the last 3 weeks. It's nothing new. Just a review of kind of summarizing. It's a summary. But if you have a good understanding of the study guide, you're going to do great on the test. You will. I promise.
Okay. So I have a question. Are you gonna send
Yep.
this
Yep.
bullet point and the recording on the in the announcement?
You already have the study guide. That
Yeah.
was sent. I will send a recording. I will send this recording to Dr. Kershaw and Dr. Ford with the attendance list as soon as, I'll probably do it after I teach class. It takes about an hour to convert, but you'll have that this afternoon. And then
All
I'm
right,
waiting
thank
on,
you.
Dr. Ford did a review on Tuesday. I'm waiting on her recording as well, so I'll send that out as well. And then
Right.
Dr. Kershaw has a review Sunday evening. I think I put that in the announcements for you. So there'll be a third review opportunity and a third recording.
All right, thank you.
Does that help?
Mhm.
Okay. Make sure everybody's name is in the chat, please, please. So you can get credit for attending. Does anybody have any questions? Has this been helpful?
We can attend all the reviews,
Yes.
right?
You can attend,
yeah.
you can attend every review. The more the merrier.
Okay.
I mean, it's the same information covered, but everybody has their different style. So. Okay.
Thank you.
Thanks you
Okay,
guys
thank
for
you.
coming. I appreciate it. And then